our asthma program at Nicholas Children's Hospital. My name is Anna Bandon. We understand that this may be a very overwhelming time for you. Your child has asthma, or he or she has presented to the hospital with clinical symptoms of asthma. You must have many questions. Our goal at Nicholas Children's Hospital is to try to ease some of the feelings you are experiencing about your child's diagnosis. I'm going to review with you the signs and symptoms of asthma, the triggers that may cause an asthma attack, and the medications. By becoming familiar with this information, you will be able to help your child at home or during a crisis. What is asthma? Asthma is a lung disease that makes it harder to move air in and out of your lungs. It causes the lung walls to swell and the airway to narrow with extra mucus. This makes breathing difficult and it triggers coughing. There's really no cure for asthma, but it can be managed so your child can live a normal, healthy life. What happens during an asthma attack? Typically, the airways are clean and open. There is no swelling. There is no restriction for the air to come in and out of the lungs. As the child comes close to a trigger and starts coughing, the lungs walls start swelling up, building mucus, making the airways narrow and difficult for the air to move freely. What are triggers? Some triggers that can cause an asthma attack are pollen, animal dander, changes in the weather, respiratory infections such as viral or bacterial infections, perfumes, exercise, and any smoking near the child. Asthmatic patients are very sensitive to the smell and smoke from cigarettes. This will easily trigger an asthma attack. What are the medications used to treat asthma? There are different medications used to treat asthma and its symptoms. Inhaled steroids contain corticosteroids, which are natural substances found in the body that help fight inflammation. Corticosteroids are used to treat asthma because they reduce airway inflammation. Medications like Flovent or Pulmicort are used as maintenance medications. They must be used regularly to be effective. Usually this medication is given for a long period of time, twice a day. Follow the doctor's indications. It is very important that you give this medication even if your child has no symptoms. This will allow the airways to stay clean and open. Some side effects of Flovent and Pulmicort are dryness, dizziness, allergy symptoms, cough, and headaches. It is important to rinse your child's mouth after each treatment. Bronchodilators like albuterol and Sopanex are your rescue medications. These relax the muscles in the lungs, which allows the airway to widen and make it easier to breathe. They help to clear mucus and reduce inflammation in the lungs. You must use these bronchodilators when your child is coughing, wheezing, is experiencing shortness of breath, or when your child is having difficulty breathing. Some of the side effects of these bronchodilators are tachycardia, which is when the heart beats faster than normal, jitteriness, and hyperactivity. Systemic steroids are anti-inflammatories that reduce inflammation in the whole body. These medications can be oral or can be given by vein. Medications such as Salumedrol, prednisolone, or Decadron are given for a short period of time, usually 5 to 7 days. Some of the side effects of these medications are headaches or upset stomach. Leukotriene medications such as Montelukast or Singulair help block the allergen component and assist the environmental allergies that can trigger an asthma attack. Some side effects are headaches, dizziness, and drowsiness. This is your MDI or your puffer, and this is your spacer. I'm going to show you how to give the medication. First, open up the puffer, spray one to make sure the medication is flowing, attach to the spacer, and you're going to place a spacer tightly around the patient's nose and the mouth. Please make sure that you never give the medication straight into the mouth without using the spacer, because the medication can stay in the tongue and in the mucosa and not really flow into the lungs. You're going to do one puff at a time. And in the meantime, they're going to be taking a deep breath. So 1, 2. Once you're done, you will close the puffer. The spacer needs to be cleaned with water and soap daily or every other day depending how often you use it. It is important to let your child's teacher know that the child has asthma and that they may have some medication available to assist them when they have difficulty breathing. This is especially important when exercising. The puffer has a marker in the back that allows you to count the amount of puffs left to allow you to plan ahead and refill the puffer when necessary. Now you are more familiar with the medications and triggers. Upon discharge, the nurse will provide you with an asthma home management plan. This individualized document, based on your child's needs, would help you to identify signs and symptoms and guide you with the medications that need to be given to successfully control or help manage an asthma attack. This color-coded chart will help you. Green is when the child is doing well. There's no coughing, no wheezing, your child is breathing great. At this point, the only medications you should be administering to your child are the Flovent or Singular, which are your maintenance medications. Yellow is when your child is having symptoms such as cough, wheezing, or difficulty breathing. Give albuterol on the first cough. This can help the asthma attack from becoming worse and possibly assist you in treating the attack at home. If your child is not improving or the symptoms are worsening, now you're in the red. Bring your child to the hospital or seek a provider. You may give albuterol every 20 minutes as long as you're on the way to see a provider. Remember that giving albuterol too frequently may increase your child's heart rate and cause tachycardia that may need medical attention. Let's do a quick review of the steps necessary to control asthma. Know your child's triggers and avoid them. Give medications as ordered by your healthcare provider even when your child feels fine, and have plenty of medications available at home and at school. So there you have it. We're here for your child and to support you. If you have any questions, do not hesitate to contact your care team, and thank you for being an active member of your child's care team.